So the SI joint is actually the joint between the sacral bone and the pelvic bone, and it actually connects the spine to the pelvis. The most common causes of sacral joint pain are the trauma, increased laxity due to pregnancy, or inflammatory disease, which affects all the joints in the body, not only the sacral joint. The most common age for sacral joint pathology is usually after the pregnancy, in some, we would say in the 30s or 40 years of age. Also, it will affect older people if they have had hip replacements or knee replacement, where there's a huge leg discrepancy between left and right, which will impose the pelvis to be in the abnormal position, and it will cause more pain in the sacral joint. Self-healing, or I would say self-mending for joint pathology, is the best way of regular exercises, stretching, yoga and Pilates. There are special exercises where you can actually ease the stress and stretch the sacral joints, but you will need to ask your physiotherapist or PT trainer. The treatment option for sacral joint is the first and most crucially, it's physical therapy and regular exercises. If the pain is not well managed with the physiotherapy, oral painkillers are the second option. And the third option, if the painkillers are not giving you sustained relief for the management of the pain, the option will be reasonable to proceed with injection, which can be diagnostic and therapeutic as well, because injection can work approximately in the 60% of the cases, but if the pain is alleviated in, we would say, between 50 to 75%, we would say this injection is quite successful. It's actually pointing that the pathology is coming and the pain is coming from your joint, and this gives us other reasons that we can proceed with different stage if the injection is worn off. The next step would be the radiofrequency ablation of those joints, which can give you more long sustained relief of the pain. The last resort of treating intractable pain from the sacral joint would be the minimally invasive surgery, in the way of putting 2 or 3 bolts between your pelvis and the sacrum and stabilizing the joint, which has a quite good success rate in the ratio of between 80 to 90% of significantly alleviating the pain.